I think the international community and the governments of the region that have been affected by Ebola have a golden opportunity not to waste the crisis. The crisis has revealed a number of weaknesses and fragilities that can be addressed to get to a more resilient and less fragile status of the economy and social development in the countries. Clearly, the public epidemic that has affected the three countries can spread beyond the borders, affect other countries. There is an urgent need to contain it and to learn how to deal with it. At the same time, the country has to put its course to a much more advanced education and capacity building mode. Resilience requires the capabilities of individuals, the capacity of institutions to be strengthened. Require a complete reform, if not revolution, in the educational system, formal and informal, requires to diversify the economy and create disaster risk reductions, and requires policies and actions to prevent and be prepared for natural disasters or disasters like this one of health nature. So I think it's an alarm bell that we have heard through Ebola that goes beyond Ebola. It's not only a health sector problem, it's a question of how to make the country more stably on a development path that delivers to the citizen and enable them to pursue this for the long term without any abrupt interruptions, which is one of those that Ebola has caused. Ebola can be contained. As you know, Ebola has been in the African continent for decades now. So somehow the virus is in the environment and is latent there. So we should expect every now and then some outbreaks. The ability of the country to have a response capacity and to have a surveillance system will have to enable countries to be able to cope with such possible outbreaks in the future as well. So lessons have been learned the hard way, and the surveillance system, also of a trans-border nature with neighboring country, are being put in place. I think Ebola can be reduced to an issue that can be dealt with when it presents itself. Beaten definitely, perhaps yes, in the medium or longer term, also with the help of scientific progress on vaccines and rapid testing. At present, the efforts of the three countries and in Liberia as well is to have in place a system that is able to implement a rapid response when there is an outbreak in a localized geographic location. So this means being able to track each and every contact, to identify and isolate the cases of symptomatic sickness as soon as possible, and be able to continue with communication and education campaign. So clearly the change in the Ebola fight has come from the community awareness, from decentralizing the response and supporting communities, empowering them to self-organize themselves with a little external support. So the key has been communication, awareness, education, more than the medical response. So I feel that this is what we still need to continue to do to get stably to zero. As you know, Liberia got there. But now we have again a small outbreak that we hope to contain very soon. But this time, the preparation is there, the response is there, so we're confident it can be contained in a short time with the very few victims. Certainly, we need to continue to be alert and keep the surveillance high. The experience with Ebola, as I said before, goes beyond Ebola. It has told us that we need to revisit some of the longer-term development strategies and adjust them to create a more resilient society, a more empowered community. For instance, decentralization is in a way the lessons of Ebola, the silver lining. Work more with the community, involve them, make them more participant, and certainly try to decentralize also investment and resources for human development. Capacity building. If the country had a higher level of education, probably we had been able to contain the outbreak a lot earlier, for instance. And finally, diversify the economy, because many of the countries are hit from all sides now, not only Ebola, but also the low commodity price, which constitute the base of their economy, are so low that make it more difficult to recover in economic terms.